you everyone for being here. Our MC for our festivities this afternoon will be Senator Richard Neufeld, and without any further ado from me, I'm going to let him take it away.
Well, good afternoon, everyone. Boy, what a great day in the city of Fort St. John and in the northeast part of the province of British Columbia as we get to officially announce the hospital construction, doing groundbreaking. And I noticed they brought a pile of gravel over here that's going to be easy for Bruce Lance, the mayor, to be able to put the shovel in. And also to Pat Pym, the MLA. We've noticed that they've had trouble putting the shovel in the ground, so we've made a nice loose pile. But anyhow, it's good to see so many people here. I've been here once before announcing this, not very loud, announcing the initial move that we made on the hospital. But today, as you can see, there's been a lot of work take place already. And officially, I'm told that these pieces of equipment are going to be doing a lot more work in the very near future. So I'd like to take just a minute to introduce my fellow stage guests. Pat Pym, the MLA for Peace River North. Give him a round of applause. Kate O'Neill, board member from Northern Health. Karen Goodings, chair of the Peace River Regional District. Bruce Lance, the mayor of this wonderful city, Fort St. John. And Jerry Green with ISL Health. There are also some special guests here in the audience today. Call it Kathy Ulrich from Northern Health, the CEO. Rick Steele, the Assistant Vice President of Partnerships BC. Councillor Jerry Atashi, representing Treaty 8 First Nations. Where are you, Jerry? And we have Janice Iceberg, the Fort St. John Hospital Association. And Barb Caldwell, a board member from Northern Health. I'd like to actually ask Pat Pym, the MLA for Peace River North, to come forward and say a few words. Pat, if you would, please.
Well, good afternoon, and thank you, Senator Neufeld, for the introduction, and welcome everybody to this wonderful day in the North Peace. I think this is a day that we'll all remember for many, many, many years to come. It's great to be here today to celebrate as we move forward on the new Fort St. John Hospital and the residential care facility. I bring greetings from Gordon Campbell, Premier of the province, and from Kevin Falcon, Health Services Minister. Kevin would have liked to have been here today, but unfortunately he's getting married, or fortunately he's getting married. He doesn't want to take that this weekend, so he's been preparing, and they're off on an awful long trip afterwards. I'd like to thank all the people here today whose hard work and dedication played a role in bringing this project to reality. Thank you all for your efforts. As many of you from around town are no doubt aware, the last couple of weeks there's been a bit of activity in the area. And it started a little bit ago, and that was all done as part of an early project that we put together so we could make the whole project flow through to the winter. We have just recently passed another major milestone, and that was getting our funding partners all put together. And this past week, ISL and Northern Health have put together the whole project. So that's a very good step in the right direction. The total project cost will be about $297 million, including $98 million contribution from the Peace River Regional Hospital District. This new hospital and residential care facility will be a tremendous asset for the people of the Northeast, and it opens in early 2012. It represents the first hospital replacement of this size anywhere in the north. It'll be a crucial component of the future care available to the residents of Fort St. John and the surrounding area. And of course, we're not only building a brand new hospital, but we're creating what will become a beautiful new home for all of our seniors. It'll include a 55-bed hospital and a 123-bed residential care facility for seniors, along with an integrated services building for centralized services as well. So it's going to be quite a facility when it's all said and done. And certainly looking forward to it. It'll also feature 2 new operating rooms and an endoscopy suite, as well as the incorporation of single-room maternity care. This project will improve access to state-of-the-art health care facilities for residents, and it's part of our commitment to enhancing health care services for rural and northern British Columbians. As we all know, northern British Columbia is welcoming and a beautiful part of our country, and the people who live here are the heart of our great province. All too often, the remote nature of our area can provide challenges in the delivery of the accessibility to health service and care services. So this new project will become a cornerstone in the revitalization of health care here in the north. Other projects that are helping to improve the health of British Columbians around the north include the Northern Cancer Control Strategy, which will include a new BC Cancer Agency Centre for the north, which will be located in Prince George. It will help us to build on our status as a national leader in cancer care. The development of the medical school, the University of Northern British Columbia, which is already training the next generation of physicians in our area. And the opening of the Northern Haida Gwaii Hospital and Healthcare Center, which is providing better care to residents of Massive and Northern Haida Gwaii by combining the hospital services, residential care beds, assisted living units, and community health programs. This project will be the first time we've undertaken a combined hospital and residential care center as a P3 project partnership. It represents an innovative way of delivering services when and where patients need them most. While it will allow us to be more efficient in procuring construction materials and labor, it will also allow us to address both the acute care and complex care needs of our growing region. And most importantly, it will provide our patients, residents, and visitors with greater access to health care and reduce the number of trips required to seek health care outside of the region. This new Fort St. John residential care facility will improve health care access here in the north. And as part of our government's 3-year, $14 billion capital infrastructure program, which includes $2.5 billion for capital spending in the health sector alone. As part of our commitment to maintaining and enhancing health care services, even during these difficult economic times. I look forward to watching as the construction of this project moves forward, and I must say it is with great excitement that this day is happening for me. And now, I'd like to invite all the fellow stage guests forward to help me unveil the artist rendering of the new Fort St. John Hospital and Residential Care Facility. Everybody come